Good morning, everybody. And sadly, we lost another Albany County resident overnight to the virus, a woman in her 90s. So my condolences and prayers go out to the family, to the other 119 people that this has happened to. Again, through these difficult times, and I just want to remind everybody, these are difficult times, the way we say goodbye now, and to be there with our loved ones. So to the family that lost their grandmother, mother, sister, aunt last night, my heart and prayers go out to you, and again, to the other 119 families. So the complaints that have been increasing slightly are largely due to people not wearing masks. So one of the things the governor addressed yesterday and through Paws New York and the complaints that we get in is the mask. And we saw yesterday when someone confronted someone in the store, the customer lost their cool and spit on the person and hit him. Listen, it's difficult, and I know not everyone wants to wear a mask. I know you feel confined. I can tell you, someone that has asthma, it's not, you got to find the right mask that you can breathe through. It's not easy. It's not easy. But, look, you have the right not to go in that store if you don't want to wear a mask. You have the right not to shop there. There's online services. There's different things that you can do. You got to respect other customers, and the workers are just trying to do their job, because I've said this early on. As we open up and we hopefully, get into phase 3 tomorrow, we're going to get more and more people coming out, more restaurants being open. It's different. And as I said, people have been home. It's been 14 weeks. So it's a different world out there. And I know it's uncomfortable when you go into a store and people have masks on or they're coughing. We got to, be courteous of one another, and we got to make sure that we address this stuff going forward. And again, you don't have to go into the restaurant. You don't have to go into the store. You don't have to go into that business. So please keep that in mind. And enforcement goes down to the consumers and the workers. And again, everyone's just trying to be courtesy. Everyone's just trying to be nice, and that's what we need to address to go forward. So as of today, we have 1,835 positive cases, up 7 from yesterday. 241 people under mandatory quarantine, that's down 126. We have 1 person under precautionary quarantine, that stays the same. And positive cases, out of the 1,835, there's just over 100 now people that have the infection, over 100. Okay, we're getting there. But we're getting there because people are wearing their masks, coughing into their arms, washing their hands, and doing the right thing. Again, I've said this early on, Memorial Day weekend scared the heck out of me, and so do all the protesters. But when you see the protesters wearing masks and doing the right thing, that's a good thing. We've had them test it, and we've gone forward, and that's been a good thing too. Yesterday there was we had a total of 5,447 people that have completed quarantine. That's down 57, which is good. And we had 1,728 tested positive for the virus, which is also good. That's down 111 people that recovered that were positive, which is good news. There are still currently, we got 10 people in the hospital. That's down 1 from yesterday. And our hospitalization rate is 0.54 of those who have tested positive. Yesterday, the rate was 0.6. So 0 people still in the ICU, which is good news. I think that's our 3rd or 4th day with people not in the ICU, which is good. And over the last 5 days, our average went up to 4.4, because we did go up to 7. That's probably the highest that we've had in a while. So I continue to urge people to get tested, to do the right thing, to go out there and continue to see your appointments, to get things done. I also want to remind people, as we continue into phase 3 starting tomorrow, it's easier for those returning to work to downtown to be able to get tested. And our mobile testing site will be up as always, but this Thursday from 9:30 to 1, you can get tested at the Times Union Center, but you must call first for an appointment. And the number is area code 518-465-4771, 465-4771. And testing for those returning to work, as always, at UAlbany, at the Seth Q Arena for essential workers, and for the people at UAlbany through the drive-thru, Rite Aid in Colony, as always, on Central Avenue. You can go to Rite Aid's website and sign up. And you can also go to Priority 1 in Gilliland at the Old 20 Mall, which is renamed. So please, the Priority 1 is 518-867-8040. And, so before we talk about phase 3, I want to go to the smart board and just point out a few things, as always, and then Dr. Whalen can point out a few things. But as you see our cases that are going differently, and you look at our chart, and I'll let Dr. Whalen do that. But I pointed this out, and actually today I was listening to a show. The governor from Texas pointed out the same thing. If you look at our 20 to 29-year-olds, and that's what we're talking about, cases are 317, and the 50 to 59 is 306. So we're actually one higher than that. And what's alarming, if you also look at the 30 to 39, the 40 to 49-year-olds, and the 60 to 69, they're pretty much all average. And then the next highest case is actually age 10 to 19. There's a total of 100 cases. And then the next lowest would be 90, would be 76, and then 0 to 10. But it's this group here that I keep talking about, the 20 to 29-year-old. That's the group that is out and about, and listen, they have no signs or symptoms. They don't feel sick. They don't look sick, but they're literally out in the community getting people sick, and that's what you have to be careful of as we go forward. And as of today, we tested 37,365. Total tested positive, 2,022, which is always a little bit different than us. And that's a positive results of 5.40. So it's one thing we continue to track is that age group. And it's alarming, and it continues to go up. But if we compare today with how many people tested through June 6th, we had 31,000 with the average, as we have here, is 6.3 who tested positive. So, yes, the caseload's lower. Where people are slowing up with the testing. We only had 8 in Arbor Hill yesterday. I'm encouraging people, listen, the virus is still there. It's still out there. We've just done the right thing. We've hit that apex. We're down on the curve. But we need to continue to test. We need to continue to see where this is at. And we need to deal with the underlying issues in certain communities so we can look at this and have a baseline for the future, how we can deal with it through not just our Department of Health, through all of our agencies in the county to change the outcome. But Dr. Whalen.
Thanks, County Executive McCoy. So again, just going through these numbers quickly, if we look at the very first curve, one thing we can see is that we're starting to level off a little bit. So these numbers, this direction is only going to go up because they're the total number of cases, but it's over time. And as you can see, we were rising pretty rapidly here, and now it looks like we're tapering off a little bit, excuse me. And this is shown by this curve. Our numbers, positive numbers, continue to be low. This is about the last week or so. We are getting less than 10 cases per day. Geographically, we still have the highest number of cases when we look at zip codes in 12203, and we know the age distribution. When we look at the racial and ethnic information, from a deaths perspective, white deaths are 86.6, and Black or African American are 12.6. This is kind of on par with our county demographics, with whites being a little bit higher than we would expect them to be. But the hospitalizations, we see a higher number of Black or African Americans hospitalized or ever in the intensive care unit. Again, I think this number is a great number to have tested this many people in Albany County, and we continue to encourage people to go and get tested. This 5.4 indicates of those 37,000 people that have been tested, that's the number that has been positive. And that's since the beginning of when we started testing. But if you look at where we are right now with 496 people tested, and this was yesterday, and 2 positive, it's really just a fraction of that number. So a very small amount of people that are currently being tested are positive, which is reassuring to us. If we look at the trends over time in terms of how much testing we are doing, we see our test numbers are kind of dropping off, but again, if you look at, again, the yellow, which you can't even really see from here, are the positives, and the blues are the total numbers tested. So we really are leaving off with the number of positives that we have, and all of that continues to be encouraging and continues to inform the decisions that have been made at the state and county level to be able to open up. We do know that these numbers have not gone down because coronavirus has gone away. So it is likely that the behaviors that everyone has been participating in for the past few months have greatly affected not only the number of cases that we would have diagnosed, but the amount of people that would have been hospitalized and would have had, unfortunately, many additional deaths had we not shut down when we did. So this needs to inform behavior going forward so that we can continue with these low numbers. As we have said, we're all looking forward to being able to open up, but it's going to be very important as we open to continue to use the strategies of masking, hand hygiene, and avoiding large groups where people are not able to distance. Those things are going to remain important, and we are going to have to continue to follow the numbers. We know in other parts of the country we are seeing cases increase as they open up, and we don't want that to happen here. So again, it's very important for all of us to continue to promote that message. All of you give a message when you wear a mask, and it's important from a public health perspective to share and reinforce the importance of these behaviors so that for now anyway they become the norm.
Thank you, Liza, as always. And, the data matrix continue to improve. I want to go over some of the updated guidelines that have already taken effect and guidelines that are getting us into phase 3. Phase 3, just to remind everyone, restaurants can now start at 50%. We talked about this a little bit yesterday. Max capacity, not including employees, obviously, in their count. Distancing between tables, physical barriers must be at least 5 feet in height and not blocking emergency or fire exits. So you can see that's going to be a little bit challenging at times for the smaller restaurants. Consumers seated at the same table must be members of the same party. And it says it may be a form of different households with a maximum of 10 people per table. So seating in bar areas and community tables are permitted, again, 6 feet apart, maintaining between parties. There's a need, there needs to be a separate entrance and exit for consumers and employees. And in personal care businesses in phase 3, including nail salons and tattoos and piercing establishments and spas and tanning salons and waxing, all starts tomorrow. Steve McLaughlin will be happy. So staff and consumers are limited to 50% of the maximum capacity for the particular areas as set by the certificate of occupancy. So again, they got to be 6 feet apart. They have to do appointments. You can't have people in waiting areas. So for the nails and all that, they already established that in the barber shops and all that. But the same thing with the tattooing and everything else. You got someone waiting, they got to wait out in their car. Can't have people waiting, and there has to be separation between the nails, getting your nails done, and pedicures. So consumers must only be permitted into the facility, as I just said. And employees must wear face covering every time they interact with consumers, and every time the employee must come in with 6 feet of another person. So yes, the governor's guidelines is this: the employees do have to wear masks. I know that some people brought that up about people not doing that. I know Cafe Capriccio decided not to open up for that reason. They didn't want people to come out and have that experience with people wearing masks. I had that conversation with Steve Barnes, and I respect it. They don't want people to have that experience. So that's all going to be up to the establishment. But again, like I said to everyone, things are different. You got to reimagine things, and a lot of menus now are online. So I got to tell you, that's what a lot of people are going to tell you when you go to a restaurant, to pull up their website and look at what's on the menu. That's the way they're doing things. So there's no menus out there. So again, you can go on the online with the NewYorkForward.gov for phase 3 and look at everything for the food service accommodations alone in Albany County. One of the things we like to point out, we're going to have over 14,400 that have already come online and will tomorrow. And phase 3 starts tomorrow if everything goes well, and our numbers were great yesterday in the control room. The meeting we had at 1,400, our numbers are lower than they have been, so which is great. So we're going to go forward, but there'll be an estimated 80% of Omni County jobs will come back online tomorrow. So we'll see more and more people out and about, which is great. But again, please wear your mask and keep the distance. So, One of the things I touched about earlier was the enforcing social distancing, mask wearing, and other state guidelines. Again, these are state guidelines. These are set up by the governor, so we have to continue to enforce them, and we need your help to do that. So again, I say to everyone out there, please, it's been a long time since March 12th. We're going to be hitting 100 days this Friday that this has been going on, and it's all up to you whether we take a step back or not, and we'll end up pausing or not going forward if our cases go up. Now, it was a little alarming, 7, what we were dealing with lies in the beginning when we were seeing 20, 30 new cases, and being so low lately, seeing 7 today, hopefully that was just a reason why that happened, but, we're going to continue to watch that and monitor it. So I don't want to go backwards. We only want to go forward. So another good news I want to share with you is Ron from the Chinese Community Center donated 5,000 surgical masks for our frontline workers. Ron, thank you to you and your company for donating the masks, because we still need PPE. We still need things out there. People are still getting it. Supplies are coming in. But as always, everyone steps up in the community, and I can't thank the Chinese Community Center for the donation. Thank you so much for what you're doing in our community day in, day out. And as always, our mental health court's there 7 days a week, 8 a.m. to 8 p.m. The number is 518-269-6634. And our 24-hour sexual assault hotline number, 518-447-7716. And as always, the United Way number, 211, and our New York State hotline. That's all I have. Thank you.